First, I'd like to start with Dr. Williams. Tell us a little about the Center for the Study of Childcare Employment and why has childcare educators been historically treated different than their K 12 counterparts? And how have we seen this specifically during the COVID-19 pandemic?
Thank you so much, Jessica, for having me in the Federal Reserve Bank team. Today, I just want to say I really appreciate the vision for this panel and inviting me to bring the perspective centered on the ECE workforce. As I understand that the goal for today is really to talk about boosting employment for families and sustaining their participation in the labor force, it's really critical, as you pointed out, especially for women, as we're seeing increased reports of them actually dropping out of the labor force during the pandemic. We know that child care for young children and children in K through 12 settings. Yeah, I said it, child care is happening in K through 12 settings, but it's critical for families to really be able to have access to care and education so that they can return to work and school. So, today my position on this panel is really to extend that conversation on supporting families in the general labor force with ECE services by centering and emphasizing the realities of early educators who are doing this work. Ultimately, we can't talk about supporting the general labor force without understanding of the inequities forced upon the ECE workforce. To do so actually would deepen those inequities for a workforce who deserves and requires support as they do the important work of supporting learning and development of our nation's youngest learners. So in our work at the center for the past 20 years, we've been conducting research and uplifting policy solutions that focus in on how the workforce is prepared, supported, and compensated. And so, to the question, ECE, we know it. It's a critical period of human development. We know how important it is to support positive effects on children's social, emotional, physical development. We have that information. We also understand that not only is ECE the crux of human development, but it's also the underpinning of supporting the general labor force. Yet somehow we see the treatment and lack of respect for the teachers of our youngest children who are doing this work, and we're seeing them being invisible and devalued as a workforce. To be clear, we have a deep history of undervaluing labor performed by women and people of color in this country. A prime example of this is the treatment of enslaved Black women in this country who were expected to take care of white children with priority over their own in deplorable and dehumanizing conditions. And this was the foundation of which childcare was developed and what we know it to be as one of the most underpaid professions in our country. And early educators earn median hourly wages of $12.12. In every state, educators are amongst the lowest paid workers. We have found that early educators experience poverty rates at 4 to 14 times higher than K through 12 teachers, depending on the state. Further, just to really kind of paint the picture of the harm that's happening across different settings and job roles, Black educators are paid on average 78 cents less per hour than their white peers. And that pay gap widens when we look at the age of the children that they're working with. So the younger the child, the lesser the pay. For example, among center-based teachers, those working exclusively with infants and toddler full-time earn about $8,000 less for their work than those who work with preschool age children. And so specifically, this is particularly harmful to Black women in centers and those of their peers who are working with infant toddlers, and also to Black, Latinx, and immigrant women who are working in home-based settings where a large share of infants and toddlers are served. When it comes to family childcare providers, 59% of them are in households that have incomes less than the national median, and that figure is 75% for Black educators. And so I point this out to say that this is a policy issue But it would be irresponsible for me to not acknowledge the fact that we're also dealing with a second pandemic in this moment, a chronic disease of racism and racial reckoning that's playing out right in front of us. And ECE is not exempt from that. So we really have to interrogate all the ways in which systemic racism is actually kind of coming into play. And I point that out to say that 40% of the ECE workforce are women of color. This is a huge contrast through K through 12 workforce, which more 80% of them are white. So during this pandemic, we're all struggling, and we've seen increased expressions of gratitude. I'm sharing my screen with quotes from early educators themselves to really serve as a backdrop for what I'm saying here today. There's also a QR code if you want to find more about our work. It'll link you. If you use your phone, it'll take you directly to our website. But what we're hearing from educators is that they've continued their work without proper support, PPE, cleaning supplies. And we found this in our research, specifically in California. Yet, we're seeing increasing gratitude for educators and folks doing this work. But frankly, appreciation doesn't pay the bills. Appreciation is important, but it's insufficient to address the realities of inequity that I just painted that the workforce is dealing with. It's only just been heightened by this pandemic. And so as you can see from the quotes on the screen, our workforce is feeling invisible, they're feeling expendable. And in these discussions I've had, they've expressed their fears for their lives, their safety, their health, their concern for ECE as a system, and the realities that they're kind of grappling with the dominant narrative really focus on supporting families as if they don't have families of their own. And so they find it really frustrating that there's oversight of the fact that they too need support. We see this loud and clear with the treatment of ECE in childcare right now, as K through 12 schools are closed, childcare is open, and many states have never shut down. And so, one of the questions I pose is what makes the ECE workforce any more immune to this disease than K through 12? And so my hope here today with this, the panel and this opportunity is for those of you out here listening and exploring ways to retain and return your workforce, that these efforts can't be absent of consideration and protection of the early educators who are doing this work.
Thank you so much. That was an amazing way to start this panel. And